Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and on our show today, our special guest is Dr. Amanda Shipley. She is the founder and doctor of physical therapy at Renew Pelvic Health in Grant Park, Atlanta, and she treats women with pelvic floor dysfunction and helps them restore their quality of life by focusing on total well-being. Welcome to the show, Dr. Shipley.
Thank you so much for having me.
Well, let's just get right into it. Tell me a little bit about who you are and who you serve.
Okay. Well, I am what's called a pelvic health or pelvic floor physical therapist, and I work with women of all ages, but especially pregnant women and mothers. Ideally, I work with women who have a desire to learn about their bodies and to achieve the healthiest version of themselves. I am passionate about prevention, so in this sense, people don't really even need an issue to come see me. They can just come for a well woman checkup. But I also am really passionate about helping those who are already dealing with issues such as pelvic floor dysfunction, core body weakness, pelvic pain, etc.
So one of the things that we really focus on in this business show and what our advice is to most businesses is to really niche down into your industry. And that's something that you've done really well. You've become an expert in a certain area of physical therapy, which is pelvic health. Describe a little bit to people like myself who don't really know the ins and outs, but tell me what exactly pelvic health is, and we'll go from there into some of the issues and the problems that people have.
Okay. Well, if you don't mind, I'll actually start with what a physical therapist is, because I feel like there isn't enough awareness about that. To be a physical therapist, we go through 4 years of undergrad college, and then we go through 3 years, usually year-round, of graduate school. So you can think of it like a lawyer, for the amount of time. And within those 3 years of graduate school, we have rotations, kind of like residencies for doctors. And so during those residencies, we have access to different experiences, and you have to work in a certain number of different areas, really. So in the hospital and in outpatient. And so just to give a little background on me, when I was doing my last rotation in PT school, and it was in an orthopedic outpatient clinical setting, I did encounter a pelvic floor women's health specialist. And really at the time, I knew a little bit about what she did, not a whole lot, but enough to be interested and to be intrigued with what she did. And I knew back then, just being so green and so young, that I wanted to get a better understanding of the entire body. So I wanted to just feel really good and master working with the whole body first before I specialized, if I decided to do that. So PTs come out and we are trained as generalists. So we have, a new grad could really go to work in a hospital or a nursing home or in a school or in a outpatient clinic, all from the get-go. And then once you kind of pick your job and then you start working in that area. So I picked orthopedics and started going down that path and could do all the, necks, backs, patients with knee pain, shoulder pain, the big toe. You name it, we work with it. And so about, 5 years in to my career, I really just started thinking again about women's health and just revisiting that desire of mine. And I took a class to work with pregnant patients. And in that class, I spent the whole time with the class in between lessons and afterward and stuff, talking with the other women who already were working with pelvic health patients, and started to get a glimpse of what it is, like what I see now in my practice, and what really fuels my fire is working with women and really men too, although I specialize now just with women, in in areas and conditions and issues that people don't really talk about, So if you think of a general PT, you have shoulder pain, you've got knee pain, you can get support from whomever. So if your knee's hurting and it's acting up and you're really frustrated because you can't play basketball with your friends after work, or you can't, walk, your dog down the street, besides the fact that it's hurting, you're just frustrated, you can talk to your neighbor, you can talk to your spouse. And so I'll go in a little bit more about what pelvic health does, but, the things that we work with are much more private and, socially not acceptable to talk about. Definitely it's painful, frustrating, but it's also embarrassing in cases. So, it's really rewarding for me and fulfilling for me to be trusted by these women who, can't share, can't really get support from most normal, avenues of support in their life, and to help them and see them to, get their quality of life back. I say that a lot, but it really is just a huge quality of life. So
I think that's definitely an issue that people think physical therapists are mainly there just for, you get an injury in sports, or maybe helping the elderly move more freely. But there's definitely specific areas within that industry that need specialists like yourself. So let's get into pelvic health, and please describe exactly what pelvic health is.
Great question. So pelvic health, you can really think of it when you can boil it down into maybe 3 categories, really. One is prevention. So with these patients, like I said, we have well women checkups. You can just come in, see me for 1 visit, and assess, how your body is functioning. If you are on the road to success for a long, healthy life, and not dealing with some of the issues that I can treat. And then with prevention also is, I work with women who are pregnant and, and they're wanting to deal and prepare for pregnancy and delivery. So that's, again, with the prevention. But I also work with women who are experiencing pelvic pain. So actually in the treatment part, and people who are already dealing with issues, then there are 2 categories there. You have the pain end of the spectrum and the weakness end of the spectrum. So typically in the pain end of the spectrum, it's painful intercourse. I've worked with patients who have been married for 5+ years and have never been able to consummate their marriage. Super frustrating. They go to the doctor and they say, hey, sex hurts. Oh, have a glass of wine. Oh, relax. They're just blown off, and not taken seriously by too many, practitioners. And it's really a condition that can be treated. They don't need to, suffer or drink to connect with their partner. There is, scar tissue adhesions from abdominal surgery. So we say pelvic floor, but it's really not just your pelvic floor. It's your whole core. So your stomach, your low back, diastasis recti. That's another condition where your stomach muscles separate when you're pregnant. And that can cause issues down the road. Constipation, incontinence. There are definitely things. And then on the weakness end, it's more your incontinence, your prolapse, when your insides don't stay inside, they start coming outside of your body. So there's a lot that I can help with.
Definitely. Now, you did mention that, first of all, you really only deal with women now, but there are issues with men that have some pelvic problems. What might they be?
Yes. And I used to treat men as well, and I may return to treating men in the future. Right now, I can't really. But men, it's typically pain, pelvic pain, so groin pain from sports injuries, tailbone pain, rectal pain. Then you can have pain with ejaculation. You could have a lot of issues with incontinence. With men, incontinence usually only happens after they've had prostatectomies. So if they had prostate surgery, whether they had prostate cancer or not, sometimes things can be damaged, or they can have some weakness that was hidden and they didn't know about, with the prostate getting larger. And so then they take the prostate out and nothing is damaged, but they just didn't realize that prostate was kind of blocking things. And they have to kind of relearn how to use their pelvic floor muscles after surgery like that.
So tell me about, you see women mainly right now. What is the biggest problem that women are having these days?
I would say probably prolapse, honestly. Prolapse means, when I think I said before, when your insides don't stay inside. And truly, we think about prolapse as something that women who have had babies deal with. And that is not true all the time. I mean, maybe it's the majority of the time, but I have worked with women who have prolapse just from years of straining. So I think underlying this prolapse is constipation. And our society, we think that, going to the bathroom, moving their bowels a few times a week is normal, healthy, okay. And it really is not. And so years of straining, years of pushing and bearing down with constipation can give you the same pelvic floor dysfunction as someone who may have had a really traumatic delivery or had many, many children vaginally and, don't have the support of their pelvic floor anymore. So
get into that a little bit. I've heard a little bit of this, through my married life. My wife has had 6 kids, and she has some of the things that you're talking about. Tell me a little bit more about the causes of this, and what exactly the pelvic floor is.
Yeah. So the pelvic floor is actually a group of muscles, ligaments, connective tissue, nerves, and it extends from the pubic bone in the front. So if you kind of reach down the very bottom of your body before your legs start, there's a little bone right there. That's your pubic bone. So from that bone in the front, underneath, kind of like a bowl, they sit at the very underneath our body, and they attach to our tailbone in the back. That's also called the coccyx. Okay. So it literally is a bowl in the bottom of our body. It has about 5 different functions, but the main ones are, support for our organs, because it literally is the bottom of our body. Sexual function with orgasm. All that is rhythmic contractions of our pelvic floor muscles. It actually works like a sump pump, like lymphatics, trying to help get pressure and fluid out of the area. It also works very closely with our trunk stabilizers. So our pelvic floor works with our deep abdominal muscles, our deep low back muscles, and our diaphragm all together to hold our body stable and strong for movement and everyday activities. So that's what the pelvic floor is. Why I have gone down the route of more holistic, looking at the whole body physically, but also considering the mental state of my patients, the stress level, their support network, their nutrition, all these things fall into place, because if we don't have good nutrition, constipation is a perfect example. So things that keep us regular it's not just one thing. It is regular exercise. It is managing your stress. It is drinking enough water, getting enough sleep. It is eating enough fiber. And I say that, really truly with whole food sources. So not going out and grabbing a Fiber One bar that you can read in the label, there's fiber. You want to have things that don't have a nutrition label on them. They're actually found in the wild. So all these things play into constipation. So if we have this underlying constipation in our society that, again, no one talks about, everyone just deals with, they'll take a stool softener, they'll take laxatives or whatever, and then otherwise they're dealing with bearing down, that wears out the pelvic floor, just increases more pressure, and it can stretch and irritate it, not irritate it, but damage it beyond what, muscles can do. And then you're looking at surgery, and, it goes down a whole road.
Okay. So when somebody comes to you with some of these issues as a physical therapist, how do you help them?
So the first visit is, before they even come into the first visit, they fill out a very detailed evaluation or intake forms. So I need a lot of information about their history, their eating habits, and a lot of details that they always laugh when they come in. They're not used to sharing. And so then the initial visit, we look at the whole body. We look at back range of motion. We look at hip strength and hip range of motion. I look and see their posture, how they're standing. All these things come into play. So then I put my hands on them and I can look at, see if they have any tissue tension, any restrictions in their tissues. They can tell me how it feels if they have pain anywhere. And that ranges from, their back, their stomach, their hips, their buttocks, and then even going internally. So with a pelvic health physical therapist, what a regular PT does not have is postgraduate work in order to do internal evaluations. And I tell people it's not a pelvic exam, not like a doctor. There's no speculum. It's just one gloved finger is placed inside. And from that, we can assess directly the functioning of the pelvic floor muscles. So when I say squeeze around my finger, I teach them how to do the contraction properly. And I can feel, are they even contracting? Are they pushing out when they think they're pulling in, or is just nothing happening? They can tell me if they have pain. I can assess the coordination of the muscles. There can be a lot of things that can be going on with the pelvic floor that even can refer out. So I've had hip patients, come in with hip pain, and we look at the obturator internus, which is a deep hip rotator. And that can refer pain out to the hip, and it's really not a hip issue. I've even had some people that were, considering surgery, and we've figured out, hey, you don't need surgery. We need to work on this muscle.
Right. So what do you think many of the problems are? I know you talked about diet being one of them, but are there any other habits or activities that are causing this? And maybe before that, has this problem always been, or has it come about in the last 10, 15, 20 years?
And what problem are we specifically thinking of?
Maybe any of the main problems with the pelvic floor.
Yeah, okay. Yes. It's interesting. I think it's hard to say if it's something that's new. I do feel that especially if we're considering new mothers or mothers in general, we don't get enough support. So I think underlying is this expectation that, you have a baby, 6 weeks later, you've got to be show ready, and everything needs to be put back in, and, you're supposed to be having sex again, or you're, may even be cleared by your doctor to have sex, which at 6 weeks, most women I talk to or don't want to do anything, down there. But so I think, maybe that is more recently where we just have this expectation to be, on and be picture ready. And, the focus does go to the baby after you have a baby. The constipation, I don't know. I mean, I think, we definitely are a more sedentary culture now. We definitely are not eating as well as we used to eat, and everything's fast food. We work. We don't have our, multi-generational support networks where we move away, we go for jobs. We just have, our peers, which I think is the rise of, Facebook groups and the support that mothers especially get with some of these online forums are fantastic, because we used to maybe get that information from the family back in the day, and now we don't have those people as readily available.
Well, Dr. Shipley, let's switch it a little bit and talk about some of the misconceptions that people might have about pelvic health. What are some things that people think and reasons why maybe they might not contact you earlier?
Yes. So that is a great question. I think a lot of people think that pelvic physical therapy is only for us when we get older. I mean, like older. And truly, the majority of the patients I see are women in their 20s and extending through their 50s or 60s. So I work with people outside of, that age range, but that really is the majority of people that I work with. So there's a good chance someone that may definitely need a pelvic health PT or may have even seen one, but you don't talk about it. We don't know these things. So the other really big misconception is that pelvic PT mainly deals with urinary incontinence. So, and to just explain, that's when you have an uncontrolled loss of urine. So you get up from a chair too quickly, or you laugh really hard, or you jump I think a lot of people have seen videos of people doing CrossFit and peeing, or in a marathon, going to the bathroom as they're running. Or it can be just not being able to make it to the bathroom in time. You get the urge to go, and you're on your way, and you're getting home, you're putting the key in the lock, and you just can't do it fast enough. So I think that's what people think pelvic PTs deal with. And, we do so much more. But, it's interesting too that I feel like, I know I've heard many, many times over and over that women especially think it's normal to leak urine when you laugh or sneeze or cough after you have kids. I can't tell you how many people have said, oh, I've had a baby, or I've had 5 babies. I pee a little when I do X, Y, or Z. It is common, yes, but not normal. It is not a normal part of aging that women should be expecting to have to deal with. So that is something that can definitely be treated and should not be tolerated.
Yeah, that's a misconception that's been spread around so much that people think that it is true and that's what's supposed to happen, but that's not exactly the case.
Exactly.
So what are some of the fears maybe that women might have about opening up and coming to you? And then obviously it's a very delicate subject. What fears do women have coming to you about their problems?
Yeah. I think fear in general about not knowing what to expect with pelvic PT, about not knowing what's going on with their body. So fear that they're never going to be quote unquote right again, especially after giving birth and immediately, really soon after, things don't look like they used to look. You don't feel like you used to. And some people can be, surprised how long that lasts. And so I think we compare ourselves too much to everyone else's, I've heard it said we compare our insides to everyone else's outsides. And can't remember where I heard that, but I love that. And it's like, everyone else's Instagram photos. And so, you're not getting your body back after a baby, or you're aging and things aren't the way they used to be, and you don't know why. And so it's that fear of, oh my gosh, am I going to not be able to do what I love to do forever, or at least a little bit longer.
Let's talk about maybe a couple of mistakes that women make maybe after having a child. They maybe neglect to do some things that would really help get their bodies back to normal. What things are usually put to the side? I know, you put on weight to have the baby, and oftentimes you retain that weight as well. What do you see as one of the common traits that, cause a lot of these problems?
Thank you for that question. I think that's a great question. So the biggest thing I think is having an unrealistic expectation that they're going to be back to their body, themselves, within 6 weeks, within 3 months when they go back to work. I mean, I tell my patients at the bare minimum, it took 10 months, not 9, it's 40 weeks, 10 months to get your body ready to bring a human into the world. And you got to at least give it 10 months to, get your feet back underneath you.
That does really, seem like in today's day and age, that seems like an unrealistic expectation that, like you said at the start, you should be good to go in 6 weeks.
6 weeks, you get cleared by the doctor at your 6-week postpartum checkup. Then the next milestone is 3 months. Some people don't get even that much, unfortunately. And so 3 months you go back to work, and I can't fit into my pants anymore. So I think women are still, I can't get back into those work pants. Women are just really trying to lose weight in those first weeks postpartum and trying to get that. I mean, it's scary. So, I mean, I really think that the biggest thing is, give yourself some grace, give your body a rest. So it doesn't matter how you delivered, you still have pressure on your pelvic floor for the entire pregnancy, downward on everything. Your organs are all moved around. And even if you had a super easy birth, it doesn't matter. It's still a birth, that happened. And so I try to encourage my patients at least 2 weeks of not bed rest, but as close to that as you can get. And then another 4 weeks of really maximum protection phase is what I call it. So, you really are getting people to help you. You have your station set up where you're breastfeeding or bottle feeding, and people bring things to you for those first 2 weeks. You're laying down with the baby as much, sleeping when they sleep. Now, once you've had one baby, I know that's super hard to do with baby number 2, but trying to ask for help and receive help, especially in the beginning. Then I think, so I really think that the overarching thing is getting back to activity too soon, pushing themselves too much too soon, worrying about weight loss too soon. But then I'd say, holding their breath. I mean, there are definitely some more nitty gritty things I can share that.
So what are the potential risks or maybe the consequences involved with somebody who says, all right, I've had my baby, now I need to get my body back, and hits the gym too quickly?
Right. So really the problem is they can stretch out what we call non-contractive tissue. So it's like ligaments and things that are not muscles that can kind of shorten and contract back up. We have voluntary control over our muscles. So if a muscle gets stretched, you can help it get stronger if it's weak, but with the ligaments, if you put too much strain on the system too soon, then those ligaments can have irreparable damage. And so I tell people that's, when PT really can't help as much. There are things like pessaries and things that can help short term, but, down the road, you may be looking at surgery to repair those tissues because it's not something that you can voluntarily contract and get stronger. If it's gone, it's gone. So not to scare people, but that's really what I try to help women see, that, in the beginning, you're trying to bond with your baby. And if you are going to breastfeed, establish breastfeeding. I mean, that's what your body is meant to do. And you get to relax and just enjoy that time with your child. You have time to hit the gym, and you have time to, get back to that weight that you were lifting or the marathons you were running. Now, the people that were in that shape before they had babies, they're totally going to get back quicker. Because they were already in excellent shape, and if they kept exercising throughout their pregnancy, that definitely happens, and that's great too. But if you haven't been, and you just don't push yourself, just take it easy. Be gentle with yourself and kind to yourself.
Right. I mean, 10 months to have a baby and 10 months to get yourself back to, where you were before. That seems like a good balance right there. Mm-hmm. Now, let me ask you to look back in your practice, one of your patients that might come to mind. Describe a situation where they came to you, some of the problems that they were having, and how you were able to work with them and share with me the outcome for them and for their life.
Yeah. So one I think I like to use as an example is painful intercourse, because I think this, like I said before, really gets kind of shoved under the rug and women aren't taken seriously. And that is a huge quality of life, issue that they want to connect with their partner and can't. And so I've had many patients come in with their partner or by themselves and be in tears. And like I said, I mean, it can be someone who's dating someone else, or they could be in a 5-year committed relationship, marriage, what have you. And so we start with, working on all the ways they're holding tension in their body. And I tell people, sometimes you have tension headaches. Well, sometimes you can have tension in your pelvic floor, and that's where you're just holding the stress of your day. And so a lot of it is becoming present in your body and aware of how you're spending 90% of your time. So just the time that you're in clinic with me is a fraction of the time, and even the time spent doing exercises or homework that I've given you is a fraction of the bigger picture, which is how you spend your day. And so I help patients see, okay, are you clenching your glutes and your butt as you're driving to work because you're stuck in traffic, and sitting through that meeting that's pretty stressful. And so trying to take deep breaths and learn how to relax their pelvic floor in this example. And then we have things called dilators. So they get a dilator, and I teach them how to use that to stretch directly the pelvic floor muscles. So we do what's called biofeedback. is one of the tricks or tools that I have in my tool belt. And that's a way you hook up the body to this machine, and it really gives you a view into the body. And so if you're weak, we can help you strengthen. And if you're have tension in your muscles, and that may include pain, we can help you relax. And so you can look at the screen and see your muscle activity really decreasing as you become more relaxed. So we practice that in the session. They practice without the biofeedback at home, the dilator, and then just exercises. I do a lot of manual therapy. So I'll work on any tightness that they have in their hips, their glutes, inner thighs usually have some, their hip flexors or iliopsoas muscles also usually hold a lot of tension for people.
And going through that whole process, how long does that kind of thing take?
It really depends. So if they've had issues for a long, long time, I tell them it's not going to be an overnight fix. It also depends on the patient. So how ready are they for change? Are they going to implement the things that I ask? And are we going to work together? And are they really engaged and going to move forward with trying all the things, everything that we talk about? I've had patients who come in and say, I really want to be able to connect with my boyfriend or my husband, but then they just have barriers to working with the dilator at home. And so, that may take a little longer for us to help them. When you're looking in that's in that situation there. If you're looking at weakness, say someone just has pure pelvic floor weakness, they have never learned how to contract those muscles, and they didn't know they needed to, be aware of that. And so we're just trying to teach them how to get stronger. This is really not the majority of what I see, but strength gains take about 6 to 8 weeks, so I tell people, okay, maybe 2 to 3 months we'll be working together. But some of the more chronic pain or the longer term situations, it can be longer than that. So.
Well, there's a lot of great information here, Dr. Shipley. Let's take it back a little bit further. I know you gave us a little bit of information at the start about what happens when you started your practice, but what actually got you passionate about physical therapy way back when?
Yeah. Physical therapy in general?
In general. Why did you decide that this was the career for you?
Yeah, I actually dove right in. So I had someone, usually people will say, oh, I had a grandmother who had PT, or I had PT myself. No, I didn't have that experience. I was in undergrad and I thought I wanted to be a teacher. And so I started just taking classes that I enjoyed. I didn't do like the pre-med kind of weed out bio and chem right off the bat. I took a junior level anatomy and physiology course, and I loved it and I rocked it. And I was just, in my zone. And I was talking with the professor, and he was the one that actually said, have you ever thought about, we talked about medicine, and I said, no, I want to have a work-life balance, and I know me, so let's not do that. And he's like, well, okay, how about PT? And I said, so I did not a rotation, like a, what do you call it, internship, clinical internship, 1 semester in undergrad, and had 4 days out of the week for a whole semester in 2 different PT locations. So I just kind of got the experience to see if it was something I enjoyed, and I loved it. I love the education part. I come from a long line of teachers, and I love the body, and I love that one-on-one interaction with people. So that's, I think, why I went from ortho, where typically you can see up to 3 people at a time. You schedule on the hour, but they come in every 30 minutes, and you're just kind of working with many people at once, and that's not me. I'm much more of a one-on-one. Let's sit down, let's talk, I want to have my attention solely on you. And so it was, a perfect fit with pelvic floor.
Excellent. Well, can you share with us a lesson that you learned earlier on in your PT studies or career that still impacts how you do business today?
Yeah, definitely the importance of the initial eval and making that connection initially with their patients. Time and time again, they are not used to people looking them in the eyes or taking them seriously or letting them share their story. So I usually run over on my evals because we talk a lot and we get to know each other. And I want those details. I'm very detail oriented to begin with, but I really saw that the more information I can get up front, and the more that I can connect with that patient and see where they're coming from and see what their frustration is. And like I said, looking at the whole person, not just that, leakage or whatever issue that they're having. It makes for a better relationship, for better outcomes, quicker outcomes, for sure. So
yeah, we're dealing with people. We're in the people business, and that making that first connection is extremely important. Well, we've been listening to Dr. Amanda Shipley. She is the founder and doctor of physical therapy at the Renew Pelvic Health Clinic in Grant Park. Dr. Shipley, what's one thing that we might not have covered yet that you would like to leave with our audience?
The one thing I would love to share is that one of the reasons that I think people don't see pelvic floor physical therapists is because of public awareness. I feel like, people don't realize that we exist, and that's why I'm so excited to be a part of your radio show and to be doing this interview today. Specifically in Georgia, up until 2015, you could not see a physical therapist without a physician prescription. So I think historically, physical therapists have spent their time educating the referral sources in order to be able to work with their patients. So like I said, that changed middle of the year in 2015. And so now we have something that's called direct access. So patients can go see a physical therapist just like you could see a chiropractor or a massage therapist. You do not need a referral or a prescription. And so I think that now PTs are hopefully, starting to educate the public more about, their right to see a physical therapist and what issues that we can treat. So I just wanted to throw that out there that,
well, we definitely, right we definitely need to get that message out then. We will share this interview everywhere we can. Now, if people want to get in touch with you, what's the best way for them to get in touch with you?
Yeah, so I have my website, renewpelvichealth.com. I am on Facebook and Instagram at Renew Pelvic Health. I am in the process of building up a YouTube channel, YouTube page, with some videos for my patients and for everyone. So that will be coming. But yeah, the website and my email is probably the best way, amanda@renewpelvichealth.com.
Excellent. Well, I'm sure there's a lot of women especially that want to get that information from your social media and be able to contact you maybe even before coming in for an evaluation. So we encourage them to do that. Well, Dr. Shipley, thank you very much for being a guest in the Business Authority radio show.
Thank you. It was a pleasure.
And to our listening audience, if you like what you hear, hit that like button, share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.